And good afternoon, everyone. Thanks for joining us as we look at this Thursday and find that there is much to consider as it relates to the coronavirus. Today, Orange County Mayor Jerry Demings will discuss the positive cases and a realistic portrait of where we are regarding the coronavirus. Orlando Mayor Buddy Dyer is here as well, and we'll discuss similar themes for the city of Orlando and other items. Dr. Raul Pino from the Florida Department of Health in Orange County has information on our testing numbers, timeframes, and other important data. Just a note very quickly, housekeeping, we do not have a Spanish interpreter, so for those of you who would like to ask the mayor questions, please ask him the questions and you will have to have them interpreted by your own TV stations or radio stations. We do not have an interpreter today. After this, we will have a very brief session that will take place in Haitian Creole. So I'm going to ask Dr. Pino to hang around for that if you do not mind for a few minutes. But we'll begin this press conference today with Mayor Demings. Mayor?
Thank you, Dr. Williamson. The only thing I would say that is because Dr. Pino is bilingual, you can always ask questions in Spanish and we'll tee him up to answer all the hard questions. But let me just say thank you for coming today. We have good news, we have bad news to report, but within that, I just concluded a 90-minute conference call with the other surrounding counties, Lake Orange and Osceola, and Seminole counties. We, on a fairly regular basis, have a conference call so that we talk amongst the counties so that we have consistency to the extent we can within our region, although each county has its own unique circumstances and demographics. From that, I can tell you that we're all concerned about the new cases that we have seen emerging within our community within the last few weeks, if you will. Our numbers are ticking upward. We've reached a grim milestone, I can tell you, here within Orange County regarding COVID-19 related deaths. We are now at 102 deaths in Orange County. That means that 102 different families have been directly impacted the worst when they've had the loss of a family member. And so our condolences go out to all of those families. Since we last came before you this past Monday, there have been 19 additional deaths in Orange County alone. Within the region, there have been other deaths as well. We also surpassed the 20,000 mark in terms of the total number of positive cases in Orange County. I go back to a month and a half ago to June the 1st, we had 2,900 cases, and now we have over 20,000 cases. To be exact, Orange County has 21,299 instances of positive cases within our county. That is an increase of 1,390 since yesterday. Now, Dr. Pino is going to get into the data with you in terms of what that really represents. Those are nearly 1,400 cases since yesterday. We have tested nearly 200,000 individuals, and our overall positivity rate, according to the state, has inched up slightly to 10.7%. So our goal is always to make certain that we are containing the virus to the extent that we can and that we are getting compliance from our various businesses. So I want you all to know that Orange County will be working with the Florida Department of Health. We will be putting together some strike teams that will be going out into the community to ensure that we get better compliance from the businesses with the executive orders and the other CDC directives that have been put in place. And so to all of those businesses that are regulated, et cetera, we will be visiting those where we get complaints, and we'll be visiting businesses in general to ensure that we have compliance here within our community. On Monday, I mentioned to you that as we monitor the numbers, the positivity rates, the critically ill patients in our hospitals, and the number of deaths, and all of that One way that we perhaps would consider restricting movement in the county would be the reinstitution of a curfew. And I've decided at this time, I don't think that that's appropriate, it's necessary at this time, but it is something that for the future, if we see the numbers continue to worsen, we will look at every opportunity to appropriately respond. Orange County's executive mask order still remains in place. To find additional information about what that order says, you can go to our website at ocfl.net/mask FAQs. On Monday morning, our Business Compliance and Consumer Confidence Working Group will be meeting to follow up on their conversations earlier this week on how to deal with businesses who are bad actors. We want to target the bad actors. And so at the meeting this week, they didn't feel like they had enough information at that time to make any recommendations or changes. They wanted further information based on the healthcare data. So on Monday, they will be meeting and reviewing the data and will likely make recommendations from there. Next week, the full Economic Recovery Task Force will be meeting on Tuesday, and depending upon any recommendations coming out of the subcommittee groups, we will make determinations at that point on any of their recommendations. Orange County Health Services' free COVID testing continues at Barnett Park until this coming Friday. All appointments for this week, unfortunately, are taken up, but I'm told that there are always some cancellations, and therefore there are people who drive up or walk up who are able to get tested. Since Monday, they have completed 1,809 tests alone at Barnett Park. That tells you that the demand for testing in our community remains relatively high. Next week, we will be again doing testing at Barnett Park, and for information on making appointments, you can go to the website at ocfl.net/coronavirus. We also have an appeal to make to the residents of Orange County. As we experience a dramatic increase in coronavirus cases in Orange County, we have learned from our partners at One Blood that there's an urgent need for convalescent plasma. Convalescent plasma comes from people who have recovered from the coronavirus and who have developed antibodies that will fight off the virus. So they have a need for convalescent plasma, and One Blood tells us that there is a 500% increase in hospital orders for the COVID-19 convalescent plasma. Donors must provide documented lab tests or a letter from a hospital affirming they had COVID-19 or provide a positive result from an antibody test. For more information on that, you can go to the One Blood website at oneblood.org. Our total CARES applications process for individuals and families it has surpassed 38,000 now. To be exact, we have 38,180 individuals and families or households that have applied for the CARES Act crisis assistance dollars. We have a total of 23,600 of those that have been approved for an approval rate of about 86%. We have seen the denials kind of taper off because people now understand the documentation that is needed. For online applications submitted on June the 15th, all residents should hear back from the team for those applications no later than on Monday, July the 20th. So far, the total money processed by the Comptroller's Office for individuals and families is nearly $9.5 million. For Orange County CARES Small Business Program crisis assistance, more than $25 million has been processed for payment to small businesses of 100 or fewer employees who have received the $10,000 grants. They are eligible if they have received Paycheck Protection Program dollars previously for $50,000 or under. Those businesses are eligible as well. Remember, last week we expanded the criteria for businesses, and that has resulted in additional applications. And so that seems to be going fairly well. Orange County opened its free self-serve Sandbag site at 5 park locations this morning at 8 a.m. This is an effort to help everyone be prepared for the hurricane season before us. We had a tremendous turnout with residents lining up at 7 a.m. this morning to get free sandbags, full of dirt. By 10:30 a.m., we were halfway through the planned distribution of supplies this morning, so we have stocked up, and we anticipate 16,000 additional sandbags for each of the locations that have been identified. Remember also that at each of those sites, we're giving out free PPE, personal protective equipment, supplies, masks, hand sanitizer to those who show up there. I guess there's a demand for that as well, because some people showed up, they didn't want the sandbags, they just wanted the PPE. So we will continue our self-serve sandbag program through July the 30th. For more information, you can go to ocfl.net/storm for more information. And so that's the update from Orange County specific. You're going to hear from Dr. Pino in a moment, but I'm going to pass this to Mayor Dyer from the City of Orlando at this point. Mayor Dyer.
Thank you, Mayor Demings. It's Thursday, so the weekend's coming, and it's important we continue to make decisions to keep ourselves and everybody in our community safe. If your plans for the upcoming days don't involve wearing face coverings and physical distancing, think about the changes you need to make to reduce the spread of the virus. Each time we go out to the grocery store, to a restaurant, to work, we need to take responsible actions to stop that spread. We must do it for ourselves, but more importantly, we need to do it for our families, our friends, our neighbors, and every person in Orlando and Orange County. Yesterday, we tested at Audubon Park K-8 school, about 270 residents. I tested as well. It's important to keep the testing going, and we're dedicated to making our testing available to residents in their neighborhoods, pedestrian accessible so you can drive, bike, or even walk. Next week, we will be at Camping World Stadium on July 22nd, 9 to 1. And just as a county, we advise you to make reservations. With that, Dr. Pino.
Thank you, Mayor. Good afternoon. As the Mayor mentioned, Orange County has 21,299 positive cases, and we have a positivity rate accumulative of 10.7. Our recovery rate as of today is 66%. We also have 102 fatalities, and I have information on up to 96 of those, but it will be lengthy to read it. The main lesson to take is that most of the people are over 80 years old, although we have a few exceptions. One individual, 55, 43, and 42. So that our prayers and thoughts with the families that are experiencing these losses. And there are still people denying that we have a pandemic. With regard to school openings, I have asked the State Health Department to give us a clear definition of what our role as officers is with regard to the emergency order by the Department of Education. As has been described to us, our role is to provide the the Board of Education here, the school board, with information that they need on the pandemic, and to assist them to develop measures to protect our children and teachers, and to open schools safely. That's the guidance that we have received from the state, although we ask for clarification with regard to the executive order. When that clarification comes to us, we will provide you with that information, and if our role is to decide if the school were to open or not, like many people have claimed, we will have no objection on making that decision when the time comes. Also, with regard to test results, we have seen, and some of our local newspapers have reported on it, there has been some issues with reporting to us from different labs. And it's difficult for people to generally understand these issues. So there are multiple labs reporting for this situation. Even some of those labs are out of the state. By law, labs, in this case of this pandemic, have to report negative and positive. The tradition in the past with other diseases is that you only report positive. So that created some issue that has been mentioned in the press, that some labs were not reporting negatives. Because in the past, again, when you have an infectious disease, what you report is a positive case, not a negative case. For example, for HIV, we don't get report who's negative. We only get the positive results. But in this case, because you are talking about a pandemic and the way that it's transmitted, you also need to have negative results to be able to determine what type of penetration the pandemic has in the community. That's why we continue to increase, first, the number of labs that are reporting electronically. That has increased lately, to avoid data entry by fax, which can create errors and delay on the data entry. But just to give you an idea of the over 1,000 cases, positive cases results that we've received today, they average 7 days. Those samples were average taken 7 days ago. And our insistence at all levels to have rapid testing, but also rapid results, is that when you get results that are a week later, there's little you can do. If you take in consideration that a person takes 3 to 5 days to develop symptoms, then they go and get tested, and then you have 7 days, and then you have to get to them. When you get to them, it's almost, the infectious period is almost gone. So that's probably part of why the transmission is going so crazy in some, especially for people who are asymptomatic and they don't feel sick, so they are less likely to, if they don't know that they were exposed, if they are not suspecting that they have the virus, more likely they will not refrain from social activities. And that's why we are insisting that everyone should wear a mask, and you have to assume that everyone has the virus. It's the only way in a pandemic environment that we can protect each other and prevent what is happening, a large number of increase in death. Just to give you an idea, about 50% of all the people that go for COVID-19 to an ICU will die. That's the data out there. With regard to back to school event, so on July 20th, next Monday, we are going to also start our back to school event. It's going to be at West Oak Mall, like we did it last year. And people, this time, to control the flow and the volume of individuals in the room, everyone have to make an appointment. The appointment is the same process. Call 407-723-5004. It is critical, important that our children are vaccinated in a pandemic environment. We will not like to see a pandemic, an outbreak on top of a pandemic, especially for measles. With that, I also would like to give you some information on tracing. So we have received additional funding from the state and from the county. It's a little bit over $5 million when you combine both. We are going to hire over 100 additional employees for the state health department. And the process is starting right now. I'm going to announce how you can apply. We would like our community to apply for these jobs, and they will have benefits. And we are recruiting over 100 people. So for that, you search for the Florida Department of Health in Orange County. In our landing page, you click About Us, and then after that, you click Recruitment, and it's going to be there an email where you have to send your resume and letter if you want to, but it's also below the email is a page that you have to fill and send with your email. It's basically the job application. The form is there, it's a state form, And then we probably will be hiring around the 20th or the 24th, before the 24th ends, meaning next week, we will start hiring. We are looking to hire about 100 additional tracers to fight the pandemic. Those will replace part of the 40 contractors that we have in place doing that job right now. With that, I will answer any questions that you may have, Mayor.
Doc, we might want to talk to him about the skills, particular
Sure.
skills.
The mayor have a very good point. Although there is a description also on the webpage, what we are looking for and what the job is going to be entitled. So we are going to hire at different levels, but most of the jobs will only require high school education. So we would like everyone that has been displaced and have these type of skills to apply. The job what entitled is going to be, first you will go through a criminal background check and drug background check that the state has that is mandatory. There's no way to avoid that. And the other piece is that these people, for the most part, will be making contact tracing, meaning calling individuals to determine when they got infected, who they are exposed, who needs to get tested, and give that type of information and guidance. We are going to hire a number of nurses, and we are going to hire a number of LPNs, and also a number of people with high school level to do the tracing. The nurses and the LPNs will be involved in testing and future vaccination that may happen if we get a vaccine. And then the tracers we engage in calling the community, calling people who have been positive, and advising them what to do and determining who may have been exposed to the disease. Thank you.
Rate of pay?
The rate of pay. I don't have it in my memory, but I think it goes from $13 to $23, depending on qualifications and the positions.
I tried to help you all out and ask him some questions before he concluded. All right, we'll open it up for questions at this time.
Mayor Lauren Seabrook, Channel 9. Today was our fourth day to be over 1,000 cases here in Orange County. We set a new record. In the last 2 weeks alone, we've doubled our deaths. At what point do you feel like there's a threshold of a certain number or a certain number of deaths, a certain number of cases where you would start penalizing people for not wearing masks? I've been listening to a lot of these meetings, and it's constantly said, if the numbers continue to increase. We are seeing that every single day. So what is your threshold to start penalizing people?
We've tried to involve the citizens in the process of making public policy, and that is the Economic Recovery Task Force. And they met this week, and there was a lot of dialogue amongst the group about attaching penalties, but they felt that they had insufficient information. So to the extent that I can, I want to get their input, and that will happen the first of next week. So within the next 3 days, we'll see them meeting again. And for me, the threshold there is when we have bad actors, we want to kind of focus on the bad actors and not all of those who are complying. So my response is to send out our strike teams and to look and do an assessment and report back, okay? And so I likely will focus, rather than just focus broadly, we're going to focus on those who are not complying and with the orders. In terms of the facial covering order itself, we are likely going to go to that next phase. But I didn't want to get in front of any recommendations from the Economic Recovery Task Force. So next week, we'll see where that leads us. And so, again, there's new cases, non-compliance. Dr. Pino shared with you in terms of even though we have a significant number of new cases, some of what he said to you is that it's related to the timing of when the labs reported information. There was a backup in the system itself. And so while the numbers are bad, they may not effectively be as bad as they appear to be. So we want to understand all of that going forward.
Ryan Gillespie at the Orlando Sentinel. A question for you, Mayor, and also Dr. Pino as well. First of all, I know about a week ago you guys were talking to us about gyms, that you guys were seeing a lot of cases coming out of fitness centers and gyms. What have you seen in the last week? Has that slowed down at all? Are you happy with the compliance that you're seeing from them? And I have a second question, but I can get to it after that.
Yeah, when I talked about the bad actors, the majority of the gyms are doing what they're supposed to be doing, and I can tell you from the coverage from this press event, the gym owners who have gotten it right are putting a lot of pressure on their peers to get in line. No one wants to see their business shut down or what have you because of the costs associated with doing that. So again, these strike teams that we're talking about, we're going to be sending them out to look. Whether they will focus on theme parks, they'll focus on gyms, they'll focus on retail outlets, etc. In general, we want compliance.
Eric Sandoval with Channel 6. Another question for Mayor Demings. Talk to me about what these strike teams are going to be, because when you say strike teams, I have a mental image, and I'm sure it's not what you guys are going to be doing.
They're not going to be wearing combat gear or any of that, or they will be wearing facial coverings. They won't be, Army mask or anything, but there'll be staff that will be clearly identified as either Orange County officials or Department of Health officials. They'll have appropriate credentials, and they're going to go in and look and inspect. And so beyond that, I won't get into everything that they'll be doing, but we won't be calling businesses in advance and saying, oh, by the way, we're on the way to inspect your business. We're just going to show up just like anybody else shows up from the public and observe and then take appropriate regulatory measures or response.
Would they be shutting them down on site if violations were found?
I don't know that any will be shut down on site unless it was a very egregious violation that violated the public health directives outright. And so it's rare instances where that can happen on the spot. So it'd be, again, the purpose is to gain compliance. So I suspect that much of what initially may occur would be warnings. We're going to come in, we see you in violation, we're going to give you a warning, we're going to document that we warn you before we take further punitive action. If it's so egregious what they're doing, that's a possibility, but that should be a very rare occurrence.
Danielle Lama with Fox 35. First part of my question is for Dr. Pino. Wondering if you can tell us a little bit more about the lag time you are experiencing between positive cases and then when they're actually reported, and then also deaths. And then part two, for Mayor Demings, how difficult is it to make policy decisions when you may not be working with the most up-to-date numbers?
So Lauren was referring to another 2 days that we have over 1,000 last weekend, I believe it was. So what we do in a case like this, where we have those outliers on the number of cases, either negative or positive, because it goes both ways, we wait until the next day and see how the data behave the next day. If it continues to behave the same way for 72 hours, then we have a major issue. If it's start going where we were, which happened last weekend, then it was a data issue. And with that, I asked our EPIs, as we were talking here, to take a look at the number of cases that got reported, the positive, not the negative. They just look at the positive. And most of the average time is about 7 days. So with that, part of what's happening, people need to understand PCR testing, which is the one that is the gold standard and the one that is getting done more often, takes time in the lab to be processed, for the reaction to happen, to identify the genetic material from the virus in the secretion. That itself takes time, hours. So If you increase your volume of testing, which we have been doing, that creates a bottleneck because you are receiving more than you can process on time. That's what's getting into the lag. Now, the next part is also that we have little control over because the analyses are done by private labs. And although they are very interested in providing the data and the right, with the right time frame, they also may have considered investments in the sense, okay, how much testing are we going to do? We are talking about a vaccine. How long this is going to last? And those equipments are quite expensive, and I don't know if they are readily available. So I think it's a perfect storm in the testing. As we increase testing and you create that bottleneck in reporting, we also had a group of labs that were not reporting electronically. That is changing. So all that has created this situation. But with the data, what we do is what I just described to you. We look for more information on the data. And people are not going to believe this one. Although our numbers have increased, last week we have a 5% decrease with regards to the prior week in the number of cases, a negative growth of 5%. This week may not get there. We may have an increase maybe between 3 or 5% with respect to the prior week, the week that we are getting. And with that, the 14-day positivity rate rolling average continue to decrease. Although this is not an information that we bluff about it, because we don't want people to have a full perception of safety. This is a risky business. And what is happening with time is you see a violation of CDC guidelines, 7 days later to 10 days later, you see an increase in the number of cases. 10 to 7 days later, you see an increase in ER visits. Then it goes like that. Then a week later, you see an increase of hospitalizations, and then you see an increase in the number of deaths. And that's where we are right now. We are seeing the number of deaths increase due to what happened 2 weeks ago when we have those huge elevated numbers that we jump from 3.9%, 4%, 5% to 17, 19, 20% that we were at.
Okay, and the second part of the question regarding policy decisions, the best policy decisions are those that anticipate a problem and prevent it from becoming a problem. And so if we don't get data until, if we don't get data in a timely manner, then it negatively affects our ability to make good policy. So with the delays in data being submitted into the system, as Dr. Pino has indicated, individuals can't make appropriate decisions in a timely manner, and that hampers our ability to stop the spread of the virus in this community. So it is absolutely critical that we get good data in a timely manner. Okay.
Michelle Félix from Telemundo. Mi pregunta es para el doctor Pino. Cada vez más negocios se prestan a exigirle a sus clientes que usen la mascarilla. ¿En algún momento el gobierno local está viendo si hay algún cambio en relación a esto, al uso de la mascarilla? ¿Podrían tomar otras medidas para que las personas en realidad usen la mask?
So the question in Spanish was, as the businesses are making a requirement for entrance to wear a mask, are we also looking about doing any other changes to the mask ordinance? Yo pienso que el alcalde respondió eso temprano. Anteriormente él dijo que están considerando, esas son políticas del condado que tiene, están considerando adicionar penalidades a la violación de las máscaras. Y también el alcalde anunció que van a crear strike teams que irían a los negocios a inspeccionar y determinar el nivel de conformidad con las ordenanzas que están y en presionar a los negocios a que hagan lo que es correcto para proteger a nuestra gente. En un futuro se está considerando si eso ayudaría a incrementar el uso. The answer in English was the mayor has explained that before, which it is that the county is considering adding penalties to the wearing face mask ordinance, but also creating the strike teams to go into business and increase compliance for those who may not.
Dr. Pino, Asher Wildman, Spectrum News 13. On Monday, you read a statement that the Department of Health could only supply data to the school district. The school district on Tuesday said their disappointment and the lack of information or opinion you were able to give. Today, you said you're looking into it. Is the state not allowing you to give guidance to the district, or why is the Department of Health not offering this kind of information to our school district?
So guidance I have given. I was there last week for 3 hours, gave all the data that they needed. The superintendent and I, we talked yesterday. Remember, there is a misconception in the sense that that meeting that we have last week was scheduled way in advance. That executive order, the emergency order, came the night before the meeting. So it was already scheduled, and it kind of threw everything upside down, to be honest with you. I have offered advice to the board. And talking with the superintendent yesterday, her question was, do you have anything new, any new data to provide the board with? And my answer was no. It is the same information, has the same level, and the same seriousness that we spoke before. And she said, okay, then do you consider you should come? I said, no, I shouldn't. It would be a distraction if I go from the discussions that you are going to have. And we will be also talking about the same thing that we already spoke about it. So that was why I wasn't there yesterday. It was that no one was running from it. It's that it wasn't necessary to be there because we have a working session the week before where I presented all the data, and the data has not changed much. With regard to making a decision for that, I don't consider that I have that authority. I really don't. But if I have it, if legal, which is analyzing everything, tells me that I do, I will take the decision that needs to be taken. But what I'm trying to avoid to do is to make a decision in public that is going to be override by someone else. So that's a concern. If I have the authority, then I have the authority. If I don't have it, then I don't have it. But what you don't want to be happening is that I advise the board in public, do this, do that, and later on you figure out, oh, he doesn't have that authority. Oops. We don't want that to happen. That will create more confusion. That will create a lot of issues. And I know there is a level of anxiety out in the community. I have received probably 500 emails. Some of them are not of the best behavior. And those has been reported to the specific authorities that have to deal with this level of threats. But again, I will make the decision that I need to make if I have the authority to make that decision. I cannot be acting like a commissioner that I am not. I cannot be acting like a county mayor that I'm not. I cannot be acting like a board member that I'm not. But again, if the State Department said to me, yes, you have that authority, we will execute it accordingly. I have no issues.
Kelsey Thord with West 2 News. Dr. Pino, my question's for you as well. You talked about the high demand in testing at the Barnett Park testing site. Are you guys looking to expand testing at this point, or can you afford that? Do you have the supplies? And then in addition to what you were saying about waiting for the average person has to wait about a week to get their results back, what do you suggest to people who go get tested? Should they act like they are positive? Because people get their test results a week later and then they're told to isolate when maybe they're not even, contagious in the way that they were. So what do you suggest?
That's the challenge. Let me take it from the bottom up. With regard to the testing and what to do, again, we should assume that everyone is positive, even inside your household. To protect elderly people where we have multi-generational living, it is critically important that you assume that when you come into your house, that you are going to hug your aunt, your grandpa, elderly person, that you have the virus. you have to assume that you were out in the community and you could have acquired it. That is the safest way to behave. The other safe way to behave is for all of us to use masks at all time, indoors and outdoors. If you are walking by yourself and walking your dog, you don't need a mask. But you have to have one because you don't know who you are going to encounter, who you are going to go face to face with. And those part of the issue that we are facing. And with regard to the testing, we don't want to increase testing because then we will increase delays if we don't have this bottleneck resolved. I mean, yesterday we received 11,000 results, a little bit more than 11,000 results. That's a lot of testing for a day. The county is doing a lot of testing. In the case of the health department, we have decided consciously to move away from testing the community at large because others are doing that. Providers, the lab, True Health, the county itself, the city of Orlando is doing it. Everyone is doing it. So we are concentrated in the part that they don't have access to, which is the outbreaks, because only we have access to that data. So we decided to concentrate on that. Last week, we did testing at the airport in a small number of cases. We are preparing also, we are in conversations with some of the people who are visiting our county to acquire rapid testing machines and be able to do more testing, but a way that we get results right away, right there at the time. And that's what is going to be our focus in the future, in the near future, where we concentrate in testing. We would like to acquire technology, if possible and feasible, to do rapid testing, because this delay of 7 days, as you said before, is not conducive.
This next question was texted in for Orlando Mayor Buddy Dyer. This comes in from Karen Parks with WFTV. Mayor Dyer, there have been 10 confirmed positive cases of COVID-19, she says, with the most recent case confirmed just a few hours ago within the city's sanitation division. How, if at all, has this impacted trash collection, and what are you doing proactively to ensure that it doesn't?
All of the 10 are quarantined, as well as 2 additional, and it hasn't impacted service at all. We're able to cover all the routes.
Dr. Pino, I just have a couple for you. This one is from Louis Bolden with WKMG. Can you please ask Dr. Pino his thoughts on the reliability of COVID-19 self-test? Would he recommend people use them?
There was a recent paper published that compared self-testing with testing done by a professional on the same individuals, and the results were exactly 100% the same. And that's something that we would like to explore. Self-testing, we may engage on that. Because what you can do with that, is you can bring 50 people, whatever the capacity here, 63, I believe, I saw outside. You can bring 63 people. You can test 63 people at the same time with only one provider. Because the only thing that you do is you give people the instruction how to do it. You also save on PPE because you don't have that many providers. You are not touching person. You are not. So it's a very nice way to do it.
This next one for you, Dr. Pino, comes in from Ingrid Cotto with El Sentinel. She would like the response in Spanish. You are the public face of the medical response to COVID-19. Many parents are trying to decide whether or not to send their kids back to school. Was it your medical assessment on whether it is safe to physically, or what is your medical assessment on whether it is safe to physically reopen schools in Orange County?
So I got the same question at the board meeting. And the key there, and some people didn't like my answer, and I understand why, but the key there is how you define safe, because we may be talking about safe in different ways. So is safe, if people interpret safe as zero transmission in the schools, no, it will happen. Transmission will happen in the school because the schools are a reflection of the community. So there's not going to be any different than what is happening in the community. It's not like people before going to school, get rid of their community involvement. It will come into the schools. Transmission will happen into the schools. It's how we respond to it. What kind of measures are we putting in place to reduce the risk of transmission? But the risk of transmission is not going to be eliminated.
Thank you. And these final two are from Mayor Demings. Oh, en
I
español.
have to say in Spanish. Yeah. La pregunta fue que había muchos padres que están muy preocupados por la situación de sus hijos y si los van a mandar a la escuela y si es seguro ir a la escuela. Y la respuesta fue que tenemos que ver cómo definimos seguro. Si la definición es que no va a haber transmisión, no es seguro, porque sí va a haber transmisión. La comunidad en la escuela es un reflejo de la comunidad fuera de la escuela. No hay ninguna diferencia. Van a haber personas entrando a las escuelas con COVID-19, van a haber personas que van a adquirir COVID-19 en las escuelas. Lo que tenemos que también es tratar cuáles son las medidas que ponemos en lugar para prevenir y disminuir la transmisión.
Thank you, Dr. Pino. For you, Mayor Demings, Alexa Lorenzo from WFTV writes in, this is going to be in regards to the strike team as well. What is your plan to ensure mask compliance? Are you also considering fines or penalties for those not wearing masks?
We will consider it next week.
Steve Hudak writes in from the Orlando Sentinel as well. Who will be on these strike teams?
Be county staff from our code enforcement division, coupled with representatives likely from the Department of Health.
And lastly, from Greg Angel from News 13, he says, we continue to hear from multiple employees of the area theme parks who describe coworkers testing positive for coronavirus. Can you describe how the county is engaging in appropriate oversight of the theme parks to ensure workers are protected and work conditions are safe? I would assume this is for both Dr. Pino.
So, we have heard of the saying anecdotal. So the parks, first the parks are not one thing. There are multiplicity of employers at the park. There are subcontractor, contractors, and people that just rent a space or have a business there. So the data that we receive is based on self-reporting. So it could be that someone is lying to us on where they work. That's possible. That had happened before because people try to avoid consequences for whatever reason. In this case, maybe not being put out of work or maybe not to be quarantined for 14 days, whatever the personal situation may be, which is very irresponsible, but it happens. So we have looked at the data, looking for the world parks, Universal, and these type of places that people are referring to. And I'm not saying that there are not cases, because again, like the schools, those are a reflection of the community that we live on it. So there are people walking the parks who are positive. I mean, that's 100% sure. There are people right here that may be asymptomatic positive right now. If we test everyone, if we go based on the data of 15% positivity rate, we should pick a couple here. So it happens. So what we have not seen in the data that we can match is an outbreak that is related to participation in the parks. That's what we haven't been able to do. And we are looking for it, believe me.
Thank you.
Okay, this concludes the press event. Thank you for being here today. We'll be back in touch with you soon.